Thank you very much, ladies and gentlemen, and thank you very mumuch, Madonna, who reminded me over and over that you have between 5 and 8 minutes, and that's all. So we'll see how we go. What I'd like to try and cover is a couple of things, and those in that short time. I'm chair of the Primary Healthcare Advisory Group, and thank you for asking the Minister this morning when that report will be released, and it apparently is very, very soon. So we're looking forward to that, and today I'd like to be telling you about some of the recommendations in that report, but I'll just touch on some of the information that we gleaned, and if you read between the lines you might recognise some things when you see the report come out. Now, what's the problem? Well, we know what the problem is in this room, particularly 1 in 3 Australians have at least one chronic condition, and that's expected to increase as the population ages. We heard about Medicare spending this morning is growing faster than government expenditure. Our risk factors for chronic disease are already high and the levels are, well, increasing. Hopefully we can turn that around. At the moment, the most startling statistic when I was preparing for the Primary Healthcare Advisory Group is that we have a preventable hospitalisation in Australia every 2 minutes. If you think about diabetes alone, it's 2.5 hours. We pride ourselves in our treatment of diabetes in this country. We don't do too badly, but we clearly can do better. And I bet there's a variation in the quality of care around the country that we need to minimise. And a quarter of the people who visited an emergency department said they could have got care elsewhere, and perhaps a GP, which is a whole lot more efficient. Our final report went in on the 1st of December, as we heard. It's just about there. It's about better care for people with chronic and complex illness, innovative care and funding models. As we said in our public consultation process, the funding and the care models are in conflict at the moment, and if we can turn that around so that the funding and the care are not in conflict, I think we'll get a better outcome. And certainly we want to connect up hospitals to primary health care. Now, when we looked around the world, we found the very topic of this session to be the case, that high-performing primary healthcare systems start with patient engagement. And not just as a passive participant, the term of activated patients was very common. Better informed, better information at the centre of care, and if we started with that, that's something that would make a difference. Risk stratification was a feature of high-performing systems, planning so that you knew the pathways that you wanted to go down, care coordination with good communication underpinning that was very important, continuous quality improvement tacked on as well, so that you looked at what you did and you improved the quality of care and the information flow back to the clinician and back to the patients continuously. Does it work? Well, just across the ditch, and I always say I hate saying nice things about New Zealand, but this is working very well in Canterbury, in New Zealand, and you'll see, it's very hard to see, but look right at the centre, it's people or patient-centred, and it certainly works, and it's something that we've looked at that we should be thinking about in this country. I won't get you to read all those guiding principles, but the first one that we came up with when we framed our report was that we need to engage patients and their carers as active partners in decisions about their healthcare. And I guess to help Anne's work in the Quality and Safety Commission, the last one is we want to support the collection, reporting and use of primary healthcare outcomes. Collect that information, reflect on it and share it. The feedback from the consultation process, which was really the basis of our report, was that there is very strong support for voluntary patient enrolment and team-based care. There's strong support for the My Health Record system and an opt-out approach, and we're seeing that played out now. There's an untapped opportunity to engage patients in their care, particularly with technology that people want to use. And the Minister's mentioned the smartphone many times and home-based monitoring. We do lots of things. We can bank with our phone, but we can't actually access our health data with it and share it. We certainly want to report outcomes, and there's a strong support for a blended payment mechanism. Now, digital health, the Minister touched on this morning, and as recently as 3 days ago said that this is a part of the great digital health revolution that literally lies in the hand of the consumer, and I'm sure she was referring to a smartphone. Just a few words on the My Health Record. As I'm on the transition task force that's delivering that, we want to increase availability and quality of healthcare. We want to reduce adverse medical events. We want to decrease the number of tests by reducing duplication, and we want to coordinate the quality of our health services. The new digital health governance arrangements are being put together right now. The Australian Digital Health Agency will be one accountable organisation, one governance process, and the board of it will reflect the key stakeholders. There'll be consumers on that board. There'll be people experienced in medical practice, innovators, private health, public health, and health informatics will be represented. A very different looking process looking at all of digital health in this country. And certainly it'll have a strategic role to evolve our digital health services. It's already started. The Minister may have mentioned about individuals in those trial sites, those opt-out trial sites have got their letters. They can tell us if they want to opt out. Another 1 million people will be added to the number of people using the e-health record. They'll be able to access their health records and set access controls, and there's an evaluation process that will come back to government. The current status, and this is the last slide, is that there is 2.6 million consumers registered today, but the important thing is that's increasing by 1,350 per day, every day, today, tomorrow and the next day. So there's an increase in the amount of registrations happening right now. Over 8,000 organisations are registered, 5,700 general practices, and the question you may ask is, are they using it? And the answer is not enough. And there certainly needs to be significant change there. Only 27 private hospitals are connected to look at and send information to the My Health record, but that's actually changing as we speak, and those senior executives in the room know which hospitals are going to be connected, and this is about making the journey easier for the patient. I've certainly had a conversation about what's the value proposition for me in my hospital, but if we can actually improve the experience for patients, I think that we'll get better outcomes. Aged care is signing up, retail pharmacies are signing up, 53 products have access to the PCHR. So the journey has begun or restarted. The process is, as I say, increasing rapidly. And we have those two dual things that will interweave with each other, the quality and safety argument, the Primary Healthcare Advisory Group looking at a new model of care for primary care, and an e-health system to help connect up primary care and acute care. Thank you very much, and hopefully I've stayed within my time frame.